Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us once again. We'll be speaking with Dr. Nicholas Robert in this segment. He's CMO of Ontada, joining us here to talk about some new research that examines potential factors that may impact care and outcomes for affected communities with a common and aggressive form of cancer, that being triple-negative breast cancer. Welcome to Health Professional Radio. Dr. Robert, thank you so much for joining us.
Thank you very much. Thank you for this opportunity.
Well, give us information as to your professional background and your role there at Ontada as Chief Medical Officer.
Sure, Neil. So I trained as a medical oncologist and have practiced in both the academic and in the community setting. But more recently, I've been the Chief Medical Officer of Ontada. And Ontada is a company that's involved in data analytics and technology in oncology. The name Ontada actually is a combination of ON for oncology and Tada, which is an anagram from the word data. Ontada manages our medical record for a large community network called US Oncology and other practicing oncologists in the community.
What are social determinants of health? Are there many, or is it kind of an all-inclusive term? Explain it for us.
Sure. So social determinants of health, which has been a topic in the last few years, both in healthcare and outside of healthcare, refers to a number of factors that may play a role in the access of care and the type of care people receive. So people think about race and ethnicity, but there are other factors like transportation, food insecurity, household incomes.
So all of those affect access to care as well as outcomes.
Absolutely. I think, all of us would like to believe that everyone in this country has equal access to care and receives all the appropriate treatments if they're diagnosed with cancer or any other illness. But I think we all know that this is not the case. And Ontada, working with our US Oncology Network, is addressing this issue. And one way we addressed it is by redesigning our electronic medical record to capture better the different social determinants of health, so we're aware of what the challenges our patients are having.
Just to be clear, Ontada's role in cancer care and research is researching social determinants of health and determining whether or not the care is adequate or accessible, or are you actually researching cancer itself, or a combination of the two?
Yes, yeah. So those are good distinctions. We Ontada, working with our colleagues in the US Oncology Network, are involved in a number of areas where we collect data and analyze it in terms of treatments and outcomes. And one area is social determinants of health. So the first thing we needed to do was do a better job of capturing the different social determinants of health, which we've done. And now we're using that information to identify how patients are treated. So we've started doing studies in that area. We did find that in one particular cancer, which you described, triple-negative breast cancer, which is an aggressive form of cancer that disproportionately affects African-American women, that there were some differences in care. The good news is there was not any difference in what we call neoadjuvant chemotherapy. So we didn't see any difference in race. But we did see some differences in genetic testing, with less testing being seen in African-American women, 67% versus 77% in white women. Mm-hmm. And that genetic testing is important to see if there's a family history or risk of the family or the patient developing other cancers, as well as it provides some information in terms of potential treatment options.
Tell us a little bit more about some of the research that was presented at this year's ASCO, some other key findings.
Yes. So we wanted to take a deeper dive and begin to identify if there were factors that led to different treatments, with the idea that the treatments could lead to different outcomes. So in patients with triple-negative breast cancer, that's a form of breast cancer where the hormone receptors, estrogen and progesterone, are both negative, and there's another receptor called HER2, which is also negative. And this is an aggressive form of breast cancer. And we want to see if these patients who normally receive chemotherapy before they have their definitive surgery, these are patients who present with early breast cancer, not metastatic breast cancer. And we found that there wasn't really a difference in patients in terms of race, in terms of receiving this neoadjuvant preoperative chemotherapy. We did see some differences in age with younger patients receiving this form of treatment versus older patients.
Now, is that something that is common in oncology as far as younger patients versus older patients? Is that something that is kind of a myth or something that should maybe be stopped? When people are affected by these social determinants of health, is it more getting the access or the disparities once they're actually in the system or the facility and undergoing treatment? Or is it a fair amount of equality where that disparity is concerned?
Well, you've touched on a number of issues. So we're practicing oncology, so we don't see a lot of visibility before the patient is diagnosed with cancer. Mm-hmm. As many people know, a good way to diagnose early breast cancer is with mammography. So that part of the cancer journey we don't really evaluate because we get involved after a diagnosis of cancer is made. Okay. But even after a diagnosis of cancer is made, there are issues. Are patients getting the same treatment options as everyone? Are there factors that interfere with that? And you talked about age, and there is a myth that older patients cannot be treated like younger patients. Certainly a very old patient with many comorbidities or even a young patient with many comorbidities can't maybe receive the same treatment because of the concerns of toxicity and side effects. But, age is a number, and, we're trained to look at patients in terms of their physiological age, what they can manage, what we call evaluating their performance status, as opposed to using age.
What, in your opinion, will the future research look at regarding these social determinants of health? I mean, we've just begun to hear about them in the last decade or so, I believe. But will other social determinants of health reveal themselves? Will we be looking for other social determinants of health in the future?
That's a good question. I don't know if we'll find additional determinants related to social determinants of health. There's quite a few, actually, and we redesigned our electronic medical records to capture this. We're using something called the NCCN distress thermometer, which helps identify a number of factors. But I think the key issue is once you identify these factors, to do something about it. So the other thing we've rolled out in our EMR with the network is a platform that helps identify how to solve those problems. So someone with transportation problems or with food insecurity, we have a platform that helps the practices identify resources to address those issues. So it's one thing identifying the factors that may affect care, but it's another to solve those problems so our patients get the same options in terms of treatment as well as the same options to participate in clinical trials.
Is there anything that you'd like to add for our listeners, and then give us a website where we can learn more about Ontada?
Sure. I would like to add that, there is a major commitment by Ontada, by our US Oncology Network and McKesson to really explore how patients are treated in the real world. Treatments are developed and identified for clinical trials, but we know that once you find a treatment does help, is to show that it really helps in, quote, the real world outside of clinical trial. And we're fortunate. We are in the community providing care, so we're well positioned to really evaluate and see how patients do in that setting. Right. So we're very committed to moving forward in that area. So we have a website, www.ontada, and please look at it. You'll be able to see what we're doing. You'll see that our goal is to transform the fight against cancer. And in addition, you'll see a number of publications that we've contributed to the literature regarding that issue.
And that's ONTADA.com, correct?
Correct.
Great.
Thank you.
Great. Well, it's been a pleasure speaking with you, Nicholas. Hopefully you'll return and give us some more information as your research continues and as you dive deeper into these social determinants of health. Thank you so much.
Neil, it was a real pleasure, and thank you for this opportunity.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Nicholas Robert. Audio copies of this program are available at healthprofessionalradio.com.au. You can also find us on Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.